YouTube. A reminder, to maintain audio quality, please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary Designee Andrea Palm, Dr. Ryan Westergaard, Chief Medical Officer in the Bureau of Communicable Diseases, and Ryan Milsistune, Chief Legal Counsel in the Office of the Governor, are available for questions. And we will begin today's briefing with remarks from Governor Tony Evers.
Good afternoon, and thank you for joining us today. I said previously that there isn't a community, a business, or a family that hasn't felt the economic impacts of COVID-19, and our state government is no different. So yesterday, we announced an additional $250 million in spending cut across state agencies for this fiscal year. This is a proactive step that will put our state in a stronger position to weather revenue impacts from the COVID-19 pandemic, while also ensuring that critical services remain accessible for Wisconsinites. While I'm still hopeful that the federal government will adopt further proposals to stabilize funding for state and local services in the face of continued inaction and uncertainty, the unfortunate reality is that we must take these steps to do everything we can to stabilize the state's budget and ensure that our economy can recover. As local school officials continue to weigh these difficult decisions, we announced today that 155 local education agencies are eligible to apply for the $46.6 million provided to Wisconsin through the governor's Emergency Education Relief Fund established under the CARES Act. This funding will go to the K-12 schools that are most significantly impacted by COVID-19 based on economic disadvantage, access to technology for kids, access to the internet, and student scores on the English Language Arts Assessment. These important funds will help support students, educators, and parents who are navigating this uncertainty by ensuring schools across Wisconsin have the additional resources they need as they make decisions about how students will learn in the upcoming school year and beyond. Folks, this is a critical time for our state, and we need to rise to the challenge before us and meet it with empathy, kindness, and respect for our neighbors and our communities. We must remember where the real fight is. It's not with each other, but against this virus. We will continue to listen to the science and the public health experts to determine the best course for our state. And as I said, the work we do right now will set the stage for later. I know folks have asked about a statewide mask order, and that's something we're looking at. But the bottom line is that every single person can do their part right now, today. The continued trend this week of record day increases in positive cases is dangerous, unsustainable, and dilutes the months of effort all of you put into staying home to help protect the health and safety of our communities. So I want to thank the many local and national businesses that have taken steps to keep customers and employees safe, like requiring masks, enforcing social distancing, and allowing employees to work from home whenever possible. But whether you're an employer, an essential worker, student, or consumer, it's on all of us to decide what the weeks and months ahead are going to look like in Wisconsin. And we cannot continue down the path we're on. Wisconsinites are resilient, and I know if we put the health and safety of our communities first, we can get Wisconsin back on track to bounce back stronger than ever. But we can't do it we can't do that if we aren't working together to flatten the curve and slow the spread of the virus. First and foremost, we need folks to wear a mask whenever you're out in public or around people outside your immediate household members. There's no conspiracy, folks. Wearing a face mask will help protect the people around you, including those at higher risk for severe illness and workers who frequently come into contact with others like nurses, grocers, and first responders. Secondly, continue to utilize alternative shopping options like curbside pickup, online ordering, and delivery whenever possible. Next, stay home if you feel sick or have been in contact with others, and contact your healthcare provider or find a community testing site to get tested. And finally, the safest thing you can do is stay home as much as you're able. And that doesn't mean stay home but host a backyard barbecue, play dates, or dinner parties, but stay home and keep your social circle as small as possible. We know that our safer at home efforts early on saved hundreds of lives and prevented countless hospitalizations. So let's double down on the practices we know we can help, that can help protect our neighbors, friends, and family from this deadly virus. And now I'll hand it over to Secretary Designee Andrea Palm for her COVID-19 update. Andrea?
Thank you, Governor. Good afternoon, everybody, and thanks for joining us again today. I want to start today with an update on our numbers. We've added 14,212 to our total number of negative tests, which brings our cumulative total to 778,842. And as of today, we have 45,899 total positive cases here in Wisconsin, which is an increase of 1,052 cases over yesterday. We are now at 878 deaths in the state of Wisconsin, which is an increase of 13 over yesterday. These numbers are at least in part a reflection of two patterns: a significant number of cases that reported attending gatherings like parties and bars and barbecues, and an increase in cases among young people. In fact, in all confirmed cases within the past month here in Wisconsin, fully 1/3 of them have been people in their 20s. Please, the safest thing to do, as the governor said, is to stay at home, limit your interactions, and wear a mask or cloth face covering when you go out. I know it can be difficult to hear these numbers. We know that each case is a person struggling with the stress of this diagnosis and what that means for their family and their health. We know that each of our 878 deaths is a person who is being remembered and missed by family and friends who feel the heavy weight of their loss. And we know that each of us is dealing with different stressors connected to this pandemic: health and financial concerns, worries related to juggling kids while working remotely, or by virtue of being an essential or public-facing employee, anxieties about the risk of coming into contact with someone with COVID-19. These stressors can certainly compound each other, and no one is immune to the stress and anxiety this epidemic has brought. The increase in calls to 211 Wisconsin asking for help with behavioral health concerns tells us that people are struggling. In fact, the need for assistance with mental health and addiction issues rank third among the reasons for calling 211, behind only COVID-19 and housing concerns. And since the start of the pandemic, we've seen an increase in suspected opioid overdoses by 117% from the same time frame last year. We need you to know that help is available and that it's okay to ask. Calling 211 is one of the ways to connect with sources of support. And the Wisconsin Addiction Recovery Hotline, which you can access through 211, is now available to make follow-up with callers to make sure that they have made the connections necessary to get the services they need. DHS is grateful to be able to provide funding to enable this follow-up program. We also continue to partner with local and tribal health departments and community recovery organizations through our Narcan Direct program to provide virtual training as well as naloxone free of charge, and we have a statewide standing order to make naloxone available without a prescription at our participating pharmacies. In addition to these programs and initiatives, as you know, we launched Resilient Wisconsin in April to provide strategies for dealing with stress and for seeking support to recover from adversity during the COVID-19 pandemic and beyond. We continue to update resilient.wisconsin.gov with more resources, including links and numbers for helplines and virtual support meetings. Taking care of your mental and emotional well-being is part of taking care of your overall health and safety. And we must remember that and continue to do our part to both stop the spread of COVID-19 and to take care of ourselves and each other. Thank you.
Thank you. We will now open it up to questions. A reminder, to maintain audio quality, keep phones on mute until it's time to ask your questions, please. We have time today for one question per reporter, and we will begin with Scott Bauer from the Associated Press. Scott.
Thank you again for doing this call. Governor, you continue to say you're looking at a possible mask mandate. Do you believe you have the authority to do that? If you do or if you don't, why not issue it and see what happens after that point? And have you considered a type of mandate with an opt-out option for local governments that would give them the ability to not follow it if they didn't want to?
Yeah, again, it's something we're considering, and clearly the number of consecutive record increases in cases have accelerated our consideration. Also, clearly, the Supreme Court left this in a very messy state. It created chaos, as I said way back when in May when this happened, and that is something that we're taking into consideration. As I said, something we're considering, but frankly, folks can right now put on a mask if you don't have one. There's nothing to prevent you from doing it.
All right, and our next question goes to WKOW and Danny Maxwell. Danny.
Hi, this is for the governor. First, we wanted to offer our condolences on your personal assistant, Ben Belzer. Wanted to know how you were doing and if there was anything you wanted to share about Ben.
Yeah, Ben was an extraordinary human being, and my wife Kathy and I miss him greatly. He spent a lot of time with us. We were essentially quarantined, for lack of a better word, but my wife and I and Ben were the three people that inhabited the executive residence. He stayed in his apartment in the evening. The thing that I'll always remember about Ben, in addition to his great skill level, his great people skill, but frankly, for the last 4 months or whatever, the pandemic, he's 25 years old, and he really shrunk his social life down to a bare minimum so that we could all feel confident that we weren't sharing the virus with each other. And, you know, this was a job for him, but he actually made it a significant part of his life by making sure that he himself was safe, and that allowed him to be with Kathy and I, making sure that we stayed safe and that the government of Wisconsin continued to function. So it was a huge sacrifice for Ben. He never said a word about it, and that's something I will never forget.
Thank you, Governor. Danny, thank you for that question. Let's move on now to Molly Beck with the Milwaukee Journal-Sentinel. Molly.
Hi, thanks again for this call. I just wanted to follow up on something that was discussed on the call earlier this week about the backlog of negative test processing. And I'm wondering if you could tell us how that affects the percentage of positive tests that the state's reporting every day. Is it actually lower than it's being reported because of the backlog?
I appreciate the question, Molly. I'll say a couple of things about that. One, I think backlog is probably a word that conveys a large delay in processing. I think, one, we are prioritizing the positive cases, which in a situation like we're in really does make sense because, right, the faster you get those positive cases into the hands of contact tracers, the more quickly that work can start, which is what is so critical about testing turnaround times and getting to contact tracers so that they can be in contact with positive cases with those close contacts to help isolate and quarantine and stop the spread. And so what we have been seeing in a number of local jurisdictions who are seeing surges right now is that while as they prioritize those positive cases, the negative cases are dragging behind a day or two or three as they make sure they're focusing on stopping the spread. So I think the second thing that leads me to remind people of is with all of this data, right? There are bumps in it, right? A single day does not make a trend, and in any of the metrics we look at or any of the data we use. And so it's why those 7-day averages are important pieces of this information to look at, because they help us understand over time and flatten out or smooth out, I guess is the right way to say it, fluctuations that either result from things like these negative cases or other reporting issues that over time are sort of come out in the wash of a trend line, as opposed to looking at everything just on a single day, in a single day sort of snapshot.
All right, thank you. And our next question is Victor Jacobo from CBS 58.
Hello, good afternoon. Thank you again for taking the call. And I also do want to add my condolences to you and the staff there. My question is about testing, specifically with the National Guard and the pivotal role that they've played throughout the state. As you know, their mission is not indefinite, but it does have an end date. So I'm wondering what's been the effort or communication been like with the federal government in terms of extending that mission, and if that does not happen, is the state prepared to take on the brunt of the cost in order to extend that mission so that the National Guard can continue doing COVID-19 testing at its sites now?
Sure. This is Brian Elsister, and I can answer that question. So Governor Evers was one of the first governors in the nation to ask the White House to extend what's called 502F status, and that's the status that our National Guard is on right now to be able to perform its mission in terms of doing testing across the state, and that because it's part of a federal mission, the federal government does cover the full expense of the Guard to do that. And while Governor Evers was one of the first governors to ask the White House, since that time, most of, if not all of the governors across the entire country have asked the White House to do the same. It's something that we've been pushing the Pentagon on and the White House on, and working with our federal partners to get a decision from the White House, and we're hoping that we get an answer any day now. We are getting to a point where we're, for a number, not just Wisconsin, but a number of states, where we do have to be taking a very close look at Plan B, though, if the White House fails to act. But we're hopeful that it will get extended through the end of the year because, as you mentioned in your question, the Guard has played an absolutely indispensable part in the state's response to COVID, with operating community testing sites and operating the SCOC, among many other missions that they've helped us to do. And this is something that Wisconsin cannot do just on its own, and we need strong federal support, and we're hoping that the White House stands up.
All right, let's head now to Denise Lockwood with Racine County Eye. Denise Lockwood. All right, let's move on. Wisconsin Public Radio and Shemaine Mills. Shemaine?
Thank you. This is a question for Dr. Westergaard. I'm wondering, with such a sizable number of positive COVID cases among young people, what your concerns about students returning to college campuses across Wisconsin this fall?
Yeah, thank you for the question. The concern has been that with any social interaction that involves close contact between people, the virus can be transmitted relatively easily. So initially there was some thought that younger individuals didn't transmit virus as much. I think we've learned that people in the younger age group and even children, even though they don't get as sick when they're infected with the virus, they can transmit the virus pretty readily. So the concern is really a communication and sort of a civic participation concern, in that is in addition to learning and reinforcing how extremely contagious the virus is, we've learned a great deal of there's been a great deal of scientific evidence about the impact of pretty simple prevention strategies. So wearing masks in public places and in 6 feet of distance have huge impacts. So I think the good news is that we have tools that we can use in combination to keep individuals safe when they convene and they gather in educational or social settings. The challenge is how to get widespread adoption on these things, and I think that's something that campuses and state governments and the public at large need to come together and try to promote, because we do have a lot of tools, we just need to use them better.
All right, thank you for that. The next question belongs to Hannah Jewell from Fox 6.
Hello, everyone. Thank you for your time. My question is for the governor. With President Trump announcing that federal agents are coming to Milwaukee, what's your reaction to that?
I opposed that, and actually I sent the president a letter expressing my concern about sending agents to Milwaukee or Madison or any place in the state. I have full faith and trust not only in the people of Wisconsin, but also the folks that serve in our police forces, whether it's at the county or local level. So the amping up the federal presence will, I believe, create more turmoil and less successful approaches to making sure that people have a chance to express their First Amendment rights while doing it safely.
Thank you. The next question to Sari Lask from Milwaukee Business Journal. Sari? All right, let's try Ben Meyer from WXPR.
I'm sorry, did it come through? Sorry, did it come through? This is Barry at the Business Journal.
Yes, we have you now. Go ahead.
Oh, I'm sorry. The phone's hard to unmute for some reason. I'm just wanting to follow up on the mask mandate issue. I'm wondering if you could elaborate a bit on where exactly do you stand in the decision-making process about issuing a mask mandate? What are the factors that you're weighing, and when do you anticipate making a decision about it one way or the other?
Yeah, it's all about the fact that our numbers are headed in the incorrect direction. Just about any of the metrics that you see on the DHS website are headed in the wrong direction. So we're taking it very seriously. Unfortunately, there are some folks in the state that don't believe that masks help. We know they do. There's no question. Even Donald Trump has suggested that it's a good idea. So we're going to continue to monitor it, and it's something we're considering.
All right, now go ahead to Ben Meyer from WXPR. Ben?
Good afternoon. Forgive me for going to the well one more time on the mask mandate question, but Governor, if you could be confident a mask order wouldn't face legal obstacles, would you have any hesitation about enacting one for the state?
No.
Thank you.
All right, moving on to Sean Kirby from Wisconsin Health News. Sean.
Hi, thanks for holding this. My question is for Secretary Designee Palm. Can you elaborate on how much the $250 million cuts will come to the Department of Health Services, and how will the agency make those cuts without hurrying its response to the pandemic? Thank you.
So Sean, I think your question was about the lapse target and the impact on DHS, particularly for the pandemic, but you were sort of going in and out. So that's what I think I'm, answering. So I would say the governor gave us that target for state government yesterday. We obviously at DHS will take the steps we need to contribute to that target. And we, on the pandemic-specific piece of that, I think it's important to realize that the Federal CARES Act dollars has really been the backbone of the response from the DHS perspective. And, while we have focused, a ton of our effort and priority on testing and contact tracing, our alternate care facility and obviously other infrastructure functions for the public health response, we certainly need in this next bill that the federal government is considering additional dollars. The dollars we have received need to be spent by the end of the year, which leaves us in need to have additional dollars at the beginning of next year to continue the response we have started here. We're going to need those dollars until there is a vaccine, because obviously testing and tracing and these other functions that we have been serving and that we have been sharing the load with our partners on will continue beyond the end of this year. So while we continue to work to figure out how we will be contributing to the lapse that we need to make with our state GPR, we do need the federal government to continue to fund us to be able to provide the critical infrastructure that we have been developing here in the state of Wisconsin to respond to this outbreak.
Thank you for that. Our next question, Stephanie Hoff from WisPolitics. Stephanie?
Hey, thank you for holding this call. My question is for Governor Evers, also about those budget cuts. And my question is about the Department of Workforce Development. I had the pleasure of listening to Caleb Frostman today during a Madison Chamber briefing. And DWD is primarily federally funded, and obviously their goal is to modernize their equipment as they continue to deal with unemployment insurance backlogs. So, I mean, do you think that DWD can make budget cuts?
Well, certainly not in the area of unemployment insurance. We cannot afford to do that. They're making good progress. We need to make sure they continue to make that good progress so that everybody that is waiting gets the resources they need in order to thrive as a state. So no, but the most of the additional money that's going to fund the expansion of the workforce there, we will not touch, and most of it is federal money anyway. But that is not the only thing the workforce development works on, and so they will need to sharpen their pencils too.
All right, let's go now to Katie Crowther from TMJ4 in Milwaukee. Katie?
Thanks so much. I believe all my questions have been answered thus far. Thank you.
All right, thank you. And we will move on to Eric Gunn from the Wisconsin Examiner. Eric.
Thank you for taking my question. This is, I think, for Secretary Designate Palm. There are continue to be anecdotal reports of people who report having been exposed, not having symptoms, and being told by their physicians that they can't get a test unless they have symptoms. In light of the fact that I believe that we're still well within the capacity for testing based on the numbers that have been reported every day, is there a message that's not getting out to people that it needs to get out to, and what needs to be done to make that, to get that communication out there?
Thanks, Eric. I think a couple of things. One, I would say I would continue to recommend that first call be to your healthcare provider. I think it's important to stay connected to your primary care and your health home if you have one. So I would continue to recommend that be your first call. If your healthcare provider is unable to provide you with a test, then I think it's the reason we have set up community testing sites, and it is why in communities with significant community spread, we certainly have not discouraged folks from seeking that testing at a community testing site. Obviously, those with symptoms, those who have been in close contact with someone who has tested positive, our most vulnerable populations, those in nursing homes, skilled nursing facilities, in those kinds of congregate settings, continue to be top priorities for us, but we absolutely, through our community testing sites, have availability for the kind of example that you just gave. And so we want to make sure that people who need tests have access to tests, but folks should continue to have that first call be to their healthcare provider to get a test through the infrastructure that they normally receive their care through.
All right, thank you for that. And we will move on now to Amy from WIC in Madison. Amy Reed.
Hi, thanks for holding this call. My question's for the governor, following up on that National Guard question. What is the plan B if the federal government doesn't extend the mission? And are you prepared to mobilize the Guard on state orders to continue helping with testing?
Well, number one, as you know, this is a national emergency, and we expect that the president understands that. Obviously, he does, because he's extended it at least once already. So we plan on having him do that, and we plan on hearing from that today. If he does not, I think that is that he would be sending the wrong signal to the people of this country, people of Wisconsin, that it's not taken seriously. That said, we need the National Guard to continue to do their great work, and we'll be strongly weighing our options to find the financial resources to keep them working for us in this area.
All right, thank you for that. We will now go to John Meisner of NBC 26. John. All right, why don't we try Mark Leland, WLUK. Mark, are you with us?
Yeah, thanks for taking the call. Governor, you had said that you are listening to the healthcare providers and making your decisions, and I'm aware that the group About Health, the coalition of healthcare providers around the state, delivered a letter to your office urging the adoption of a statewide mask mandate. I'm wondering, what weight does this have on your push forward, and what efforts have been made with the Republican leadership to actually work out a statewide mask mandate?
And of course, just knowing the data myself, I know that this is an important issue. We've been encouraging people to wear masks. We've been encouraging people to wear masks. We've had celebrities across the state participating in public service announcements around wearing masks. We need to do more. So regardless who writes us letters, we think it's an important issue. So we're strongly considering it, and we will continue to monitor the situation. But it is an important time. We need to make sure that we tamp this down now, so that we can continue to have options as it relates to our economy and our education system.
And our next question now to Asal Razai from Spectrum News 1. Asal?
Hi, can you hear me?
Yes, we can hear you.
Hi, so my question, I guess, is for DHS. Just wondering, flu season, I feel like, is going to be here before we know it. Any concerns or plans already in place for the flu season coming up, with us being in the middle of a pandemic? Any plans in place, or is it too soon to tell?
I really do appreciate the question, because it gives me an opportunity to start talking about the importance of getting a flu vaccine. I think as soon as those are available, people should seek them because, to your point, flu season on top of a COVID-19 pandemic is going to result in many more people presenting with symptoms that are very similar to each other. And the only way to sort through them is through testing to figure out, do you have the flu? Do you have COVID-19? Or do you have, the common cold? But either way, it is going to increase the workload for our healthcare system, for our local public health departments, and for this response more broadly. And one of the most important things we all can do is get the flu vaccine to take that as much off the table as possible so that our response can continue to be as robust and able to handle what will be increasing illness as flu season comes upon us on top of this pandemic.
Okay, and our next question, Andy from PBS. Andy, are you there?
I wanted to ask the governor for this round of budget cuts. Are you anticipating the university system to be to the state agencies?
I think the question is the University of Wisconsin part of those anticipated cuts? And the answer is yes. We're in the middle of conversations with University of Wisconsin system to have them help us put our budget in the best place possible. And so, yes, we will have expectations for them, and we've already communicated that to them, and we're going to have ongoing discussions around that.
All right, and we will now go to Mitchell Schmidt, Wisconsin State Journal. Mitch.
Yeah, thank you very much for the call today. I don't know if you touched on this. My phone broke up a little bit, so I apologize if you did. But during the first round of department cuts, DHS had about a $7 million cut. I was just wondering if you might be able to talk a little bit about kind of where those cuts took place within the department and if that had any sort of an impact on the department's COVID-19 response effort. Thank you.
So I'm going to have to get back to you on details of where those came from. I can't remember off the top of my head. I barely sometimes remember which day of the week it is at this point. But I'm happy to have further conversations about that. As it relates to COVID and our response, we certainly prioritized our ability to continue to do what we needed to do in this response, both in the first and in meeting our first lapse target, and we will continue to do that as we sharpen our pencils, as the governor says, and figure through how we will meet this second target. But obviously our pandemic response is a top priority.
And we now go to Jeremy from Urban Milwaukee. Jeremy.
The Badger Bounce Back plan calls for 85,000 tests per week. I think we've just hit that point for the second time over the course of the outbreak, but the positive case rate is trending upward. Is that 85,000 case threshold still something that's like a good target, or what should the level the state should be shooting for?
That's a great question, and I think there's sort of two pieces there. One is the number of tests we actually do per day and per week, and then what our capacity is beyond that. And we continue to believe, as part of this response, that we need to push both of those numbers up, both the number of tests we're doing on a daily basis, as well as our capacity to do tests. That sort of gets back to the question about flu season and what we're seeing in this surge and what we're seeing around the country is that demand for testing continues to rise. The fall certainly, if you were a betting person, you might bet that we're going to see even more demand for testing. And so our ability not only to meet daily demand, but also to anticipate future demand and be ready for it are both really important things that we here in the state of Wisconsin are focused on as part of our priority and part of our response. And it is, again, why it is so critical that our ability to through this next federal piece of legislation, get additional funding to maintain the testing infrastructure we have developed and continue to build it is really a critical part of our success moving forward. And so we're anxious for that proposal to move forward and for us to understand how it will impact our testing infrastructure moving forward. But we do think that and are interested in getting above, well above 100,000 tests a week as part of the strategy to make sure we are testing adequately to understand our prevalence, to do the quick wraparound to stop the spread and do the best we can in this outbreak.
Our next question now, Jessica from North News. Jessica?
Yes, my question is for Dr. Westergaard, and it is in regard to isolation facilities for COVID-19 patients. From a public health standpoint, is there any harm or negative stigma that occurs when communities choose not to provide the locations of those isolation facilities?
I'm not certain I understand the question. Is there stigma with communities not disclosing the location of the facilities? So
Correct.
So the availability of those facilities can play a very important role. We learned early in the epidemic is that household transmission from infected people to their close contacts was a real driver. So the ability to have a safe place to isolate and quarantine is tremendously important and is probably an underutilized strategy in Wisconsin and elsewhere. So the communities that have had those, I think our position would be to encourage their use and awareness. If the specific location of those is a matter of privacy or secrecy related to stigma concerns, it's not something I've heard a great deal about. I don't have a great answer to that question. I think the most important thing is that those resources, if they're available, are accessible and used by people who need them.
Right, and we will now go to Brianna Riley from the Cap Times. Brianna, do you have a question?
Yes, thanks so much for taking my question. Governor, you said the Supreme Court decision in May has hamstrung the state's response to COVID-19 in regards to issuing a statewide mask mandate, but the administration may retain the ability to regulate K-12 schools in this arena. Recently, we saw the UW system require masks to be worn in campus buildings statewide. Are you considering an order requiring that K-12 teachers and students attending in-person classes wear masks within school buildings?
Well, if we have, if we do an order, and that's something we're considering, we will address that in that order. But in turn, we have to understand that, at least I believe that school districts are doing a good job figuring out what's going to work for their communities, are following science, and won't put children or teachers or others in harm's way. And so it will look different in different places across the state, and any order that we would do would need to consider that.
All right, thank you. And we will go to John Stocklet from WMTV in Madison. John.
Thank you very much. Governor, this question is for you. The WIAA Board of Control voted to proceed with the fall sports season, high risk being pushed back to September 7th, low risk starting August 17th. If you had, let's say, a son at high school age, would you want him playing football? What do you think of the decision?
Well, it's easy for me to sit back and second guess anybody's decisions on this. It's obviously a crucial decision for the WIA. That's their job. I just hope they take into consideration that locals are making most of those decisions in addition to themselves. For example, I know the Big 8 conference is canceled most or if not all fall sports. And so again, the local decision makers on this issue of schooling and what's part of schooling is obviously extracurricular activities are things that frankly are being figured out locally, and I think they're doing a good job at that.
Okay, our next question belongs to Bruce Marcus at WRJO. Bruce. All right, why don't we try to move on to Maddie Heim, the Appleton Post-Crescent. Maddie.
Hi, thanks for taking this call. Just going back briefly to the delays in processing the negative tests. If we're behind on those, does it mean that the percentage of positive tests could be lower than it's turning out to be right now because those negatives are lagging a little bit?
Again, Maddie, I think on a day-to-day basis, it certainly impacts those numbers, but it is why those 7-day averages, because those numbers are coming into the system, and you can understand the trends and the trajectory and the issue in the full picture using the 7-day trends that we're also posting on the website. And so I would just remind folks that those are, whether we're thinking about our case activity burdens and that dashboard, or our gating criteria, or a variety of metrics, those we try to put them in context over a period of time to smooth out those data issues more broadly. And so I would encourage folks to utilize those trends to help us understand more broadly the picture here in Wisconsin.
All right, and now we will go to Pari Cruz from Telemundo. Pari?
Hi, I'm filling in for Pari. My question is, Chicago's mayor said this week that Wisconsin is very close to being added to Chicago's travel quarantine list. Their metrics show that basically that will likely come next Tuesday if Wisconsin has 15 or more new cases per day per 100,000 residents. My question would be, what is your response to this, and what does that say to you about the way that the state's cases are headed at this time?
Is this for me? I'm sorry. Yeah, okay, I'll answer it even if it's not. Well, we'll see what happens. I mean, it's difficult to prognosticate what they're going to do in Chicago, but the fact of the matter is there are folks, that's just let's put it this way, it's very difficult to regulate state boundaries, or in this case, the city of Chicago boundaries versus the boundaries of Wisconsin. There's lots of people that live in Illinois and live in Chicago that do work regularly in Wisconsin and vice versa, and I anticipate that will continue to move forward. But what the overall one is, the message for us in Wisconsin should be, if Chicago thinks our people should stay home, then we better put some damn masks on and make sure that we continue to reverse the course that we're in. But on a practical, so just from a messaging point of view, that's the message for me. But on a practical point of view, they won't be putting roadblocks up and checkpoints going into Chicago, and we won't be doing it in Wisconsin. And so it's more of a message issue for me personally, and I think we should take it seriously and put on a mask.
Thank you. Good advice, Governor. We will now, we've completed our list, but we have 3 reporters who we were unable to get to. So let's try to go back to Denise from the Racine County Eye. Denise, are you there? All right, how about NBC 26? John from NBC 26?
Yes, can you hear me?
Yes, we can hear you.
Thank you. Well, once again, probably for Secretary Palm, not to continue to harp on the backlog issue, but just wanted to get a sense of how widespread the backlog issue is. You know, if we're looking at just county data day by day, I know Dane County reported it was a solid 10 days behind on their backlog. Is there similar problems elsewhere in the state?
So Dr. Westergaard may have more specific details. What I know is that as we have seen surges in a couple of parts of the state, those local jurisdictions have called on us to help with contact tracing and with other functions that allow us to continue to move forward and move as quickly as possible on prioritizing positive cases so that we are moving as quickly as we can to stop the spread. If Dane says they're 10 days behind, I certainly believe what they say, and folks are moving as quickly as possible to get those negatives into the system so that they are reflected in the larger numbers. And we will continue to work through these issues with the local jurisdictions, recognizing that to stop the spread of this disease, we really do need to make sure that we are moving our positives into contact tracing as quickly as possible.
Right. Our final question, we will try to reach out to Bruce Marcus at WRJO. Bruce at WRJO. All right. Well, with that, we will wrap up today's briefing. We want to thank you all for your participation. Please continue to monitor the DHS COVID-19 web pages for data and for guidance, and additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, and the Department of Children and Families and Wisconsin Emergency Management. Be safe and have a great afternoon.